So when I was 18, sorry, I was at school and sat next to Jo, a girl called Jo, a good friend of mine in double maths, who was complaining of headache. And I said to Jo, you know, sack it off, it's double maths, go home. And in those days it was before mobile phones, and so we thought nothing more of it really, but came into school Monday morning to find out that Jo had died during the weekend.
I was 25, I was fit, I was healthy, I was active. I was working as a staff nurse, again at the emergency department at Manchester Royal Infirmary, and I was to go in for some routine surgery on my kidney for a congenital abnormality. I was told I'd be off work 9 weeks for recovery and that there shouldn't be too many complications. That wasn't the case. I ended up being off work for a year. I was septic twice. I had 2 visits or stays in the intensive care unit. I had quite significant abdominal surgery due to sepsis, and I had a stay in the high dependency unit as well.
So she'd gone home that night from school with a bit of a headache. On Saturday she was admitted to hospital, Saturday night intensive care, and she was dead by Sunday morning. And I think that influenced me. I already wanted to be a doctor at that point, if you know what I mean. And you know, you always look back at these things in retrospect and you think, oh, if she got her antibiotics a bit earlier, if someone had noticed what was wrong with her, would she still be alive today? And you know, that kind of lived with me.
I remember one day feeling really unwell. My dad came in from work and he asked how I was doing as part of my recovery. And I said, oh, I don't feel too well today. And we just brushed it off to be, you've just had surgery, you're bound to feel a bit unwell, take it as we go. I went to bed that night and I remember waking up at 3 in the morning, feeling terrible.
I was at work, normal day at work, and towards the end of the day I started to feel as if I was getting flu, sort of cold and hot and shivery, and a bit achy and tired, typical symptoms you would associate with flu or a cold.
The doctors and nurses then must have gone, why is she sat at home? She's a nurse, she knows this. And yeah, we shouldn't be trying to justify symptoms, we should just be acting on them.
So I collapsed in A&E, I was told, and then went straight to ICU, where they intubated me and put me in an induced coma. And I think I woke up 4 or 5 days later.
I remember just my dad scooping me out of bed and putting me in the back of his car, and it was snowing. It was April and it was snowing, and he drove as quickly as he could, and I remember just shouting, we have to get to hospital, we have to get to hospital.
I think what I could see then already was that my fingers and, well, not just my fingers, I think my arms from about the middle of the upper arm where the skin was black, both arms and both legs. So I could see that. I was in tremendous pain.
It's a funny one because you're there, you're living it, you're being treated, people are talking about you at the end of a bed, they're talking to your family, they're telling your family how serious it is. And I remember a doctor saying to them, if you hadn't have got her to hospital when you did, 3 hours would have been a significant difference and she probably wouldn't be here. It would be a completely different story.
That was really scary. I felt so uncertain of the future in terms of what was going to happen to me. So you hope, and you hope all the time, but you're also not stupid, and you realise now, well, if it If the circulation didn't come back within a few days, it's not going to come back now.
And I'll never ever forget the look in my mum and dad's face at the end of the bed when the doctor said 3 hours and she probably wouldn't have been here. And I was only 25 at the time. That'll stay with me forever.
When I realised I was in ICU and saw how my body was damaged, I obviously started to understand how seriously ill I was. It's so serious that you are possibly close to dying, and that in itself is a very traumatic thought. That was really scary. 4 months after the incident, both my legs were amputated below the knee, and I lost most of the fingers on my right hand, finger on my index finger on my left hand, and quite a lot of scarring on my face.
We understand that sepsis kills people, but I think the other side of that is the patients that do survive are often left with psychological effects and physical effects. So they have, this is a life-changing event for people. So obviously it's got mortality, but it has also morbidity. So, and Jacko is a good example of someone that has both physical side effects because of his damage to his limbs, and I looked after him during that rehabilitation phase when he was having his surgery to try and improve the function in his hands and in his limbs, and you know, his mobility phase, and then talking to him about the psychological impact, the distress both of his physical injuries, but also the psychological impact of being so unwell. And I think that's something I think personally I've come to appreciate a lot more, that in the survivors of sepsis, what their outcomes are.
It's changed my life radically for the obvious physical reasons. The most difficult, I think, for me was the psychological changes of well, first of all, realizing that I developed post-traumatic stress disorder. At first I thought I was only depressed, which I thought was natural after such a, illness. But there were lots of other symptoms which I, even though I'm a psychiatrist, ignored. The anxiety, the excessive worry about getting infection again, the nightmares, the flashbacks when I heard sirens or saw something that reminded me of hospitals or ICUs or serious illness. There's still the psychological effects of a change in appearance, especially my face, which is more difficult for me to deal with.
We know that some of our patients are left with lifelong disability because of their sepsis. And again, we want to try and save lives, but also we want to end up with patients with a better quality of life than they would have had, which again is one of the drivers to try and improve the care of patients with sepsis. So not only get them alive at the end of it, but get them alive but in a better psychological and physical place afterwards.
I felt sad, I was scared, I was absolutely petrified. I didn't want to die. And if I hadn't been sort of young, fit and healthy, would I have been here today? I don't know. I don't think so. I don't think I would have been.
So I'm really pleased that sepsis has become a term that everyone is using. I think the problem with the definition of sepsis is really understanding what it is. Sepsis is the way that the body deals with the infection. So sometimes that response becomes over-exaggerated. So instead of just becoming a little bit feverish and say some red swelling on an abscess, that what you develop is this syndrome where your body reacts against it. We call that a dysregulated response. So the immune response to that infection becomes out of control, and that can affect all the organs in the body. To me, it's a combination of both having the infection, but then also your body's reaction to it being abnormal. Part of it's defense response to get you better, but that becomes more extreme and becomes dysregulated, becomes out of control, and that's where we need the intervention of the treatment, and that's what makes you sicker than you would be normally.
The earlier the symptoms of sepsis get recognised and the patient can get treatment, the better the outcome is.
If you can get antibiotics and fluids and oxygen into your patient within 60 minutes, their outcome is much better.
So optimal management improves outcomes and quality of life afterwards, and I think that's what we've got to do and what we've got to strive for as healthcare workers looking after patients.
If we act fast and in a timely manner and get interventions into patients, it saves lives, so it's hugely important.
Always have in the back of your mind, could this be sepsis? And if you think, right, I can definitely exclude it, fine, but if you think it could be sepsis, then screen, look at the patient properly and initiate early treatment. That was me in an ED department, in a GP surgery, at home, with a life-threatening infection. I'd want someone to be as proactive as possible at getting the treatment in, which, if it's a bacterial infection, is antibiotics, to get them to me as soon as possible.
See it.
Say it.
Sepsis, six it.